Next would be best practices and safety considerations for microderm. So again, it's very important that you explain to your client the procedure and again, expected outcome and again, realistic goals. I think for anything that's more of an advanced treatment, your client needs to know what is it that they can expect from the treatment. And they also need to know that what you expect from them and what they need to do at home, right? So in a diagnostic facial, of course, or skin analysis before scheduling the treatment, know, any conditions that you may see on the skin, again, dehydration, hyperpigmentation, open lesions, and any other skin condition. Also choose the level of exfoliation, whether it's the microderm treatment based on the client's skin condition and the results desired. So it may be that your client, you want to start them off with microderm, and if they're wanting to try maybe a little stronger enzyme peel, and then later graduate them to a low percentage chemical peel, that could be something that you do, okay? Obviously, consultations are very important, making sure that you're following the manufacturer's instructions. I know I'm saying everything kind of very repetitive, but it is being very repetitive in the actual book. Microdermabrasion exfoliation procedures should be used with extreme caution during outdoor exposure and should be avoided in some cases where the client is not willing to take precautions to avoid inadvertent exposure during their daily activities. Again, very much the same. If your client is not willing to commit to staying away from the sun or doing outdoor activities for a while, then perhaps these are not the treatments for them, okay? And it is okay to say no, you guys, all right? Okay, let's move on to our next page, which is page 660. Safety maintenance for microderm. Daily care and proper use prevents unnecessary machine repairs. With any type of machinery, tools that you use, you want to take care of them, right? Microdermabrasion machines consist of internal motors, hoses, filters, and handpieces. Hoses and handpieces must be dry so that the crystals will flow properly. You don't want anything to get clogged. Use only the crystals recommended by the manufacturer. It is not necessary to overuse crystals to obtain good results. A constant, even flow of crystals will give a smoother and effective treatment. Crystals should flow onto the skin surface only. Avoid breathing the crystals again or getting them in the eyes or the nose. Carefully clean up the crystals while wearing rubber gloves and a mask. Machines that have separate crystal containers for clean and used crystals are preferred, okay? The treatment room and linens also need to be cleaned and checked for crystal residue and contamination. Okay. And I think more so nowadays, we're using a lot of the diamond tip or the hydroderm type of microderm versus the crystal machine. Explain the benefits of laser technology. Okay, so lasers are medical devices used for hair removal and skin treatments. Laser is an acronym that stands for light amplification, stimulation, emission of radiation. Lasers are high-power devices that are intense pulse of electromagnetic radiation in a single wavelength at one time. One of the many differences between lasers and other light therapies is that depending upon the skin condition you are treating, lasers are designed to focus all of the light power with the same color, traveling to a specific depth in one direction. In contrast, other light therapies such as intense pulse light, also known as IPL, have multiple colors, depths, and wavelengths, and the light may be scattered. The most important point to know about light therapy is that the equipment you use is selected based on the skin type and condition you are treating. Different wavelengths affect different components of the skin. Laser works by means of a medium, okay, solid, liquid, or gas, or semiconductor that emits light when excited by the power source. The medium is placed in a specifically designed chamber with mirrors located at both ends of the inside. The chambers is stimulated by the energy source such as electrical current, which in turn excites the particles. The reflective surfaces create light that becomes trapped and goes back and forth through the medium, gaining energy with each pass. The medium determines the wavelength of the laser and thus its use. Lasers and IPL are strong machines that are rated as Class 6 medical devices by the U.S. Food and Drug Administration. LED is rated as a safer Class 1 or 2 device, and it is regulated less strictly. Not all the states allow estheticians to use lasers or IPL, and some states will not even allow the use of LED unless you are under a doctor's supervision. Okay? All right. Oh no, that's Class 4, sorry. Class 4 medical devices, you guys, not 6, Class 4. So when to use and effect of laser technology? Obviously, to do IPL or any type of laser work, you do need to be a laser technician, okay? So when to use and effects of laser technology? Please highlight the following. All lasers and light therapy methods use selective photothermolysis. Remember that thermolysis means heat effect, okay? Lasers emit light waves of the same wavelength, while non-laser photo devices such as IPL use a spectrum of different wavelengths. For skin rejuvenation, heating and damaging the dermal tissue stimulates fibroblasts to repair and rebuild tissue as collagen. The laser is a precise tool used for surgical procedures. In laser skin resurfacing, pulsed lasers are so precise that they can be directed to burn off the surface of the skin without ever touching the lower dermis. Okay, you obviously need to know what to do. These different treatments can stimulate collagen production, reduce spider veins, reduce hair growth, or even peel the skin. Some lasers target specific substances such as melanin, dark hair, blood vessels, skin growths, and pigmentation that absorbs the energy from the laser. A 755 Alexandrite laser is known as the gold standard laser for hair reduction in Lower Fitzpatrick clients. A laser, produces color light. Wavelengths are selected to treat a range of skin conditions. For instance, one laser is designed to produce yellow light. Yellow light was selectively absorbed into the color red. Laser, light passes harmlessly through the skin and targets only the hemoglobin of the red blood cells, The laser energy then heats and destroys the cells, leaving the normal skin cells completely intact. Lasers are now more commonly used for non-invasive procedures. Types of lasers include the Alexandrite diode and the YAG. Another treatment is referred to as photodynamic therapy, and it is best for primarily treating actinic keratosis. Many manufacturers have different names for their devices and specific treatments, which can be confusing, New devices are constantly coming onto the market. Highlight and put a star next to the following. Lasers combined with radio frequencies are considered to be even more effective. This combined energy technology targets and heats connective tissue to stimulate collagen production and produce a firming effect. Radio waves of certain frequency penetrate and are absorbed by the tissues. The strong damaging heat effect is what promotes skin healing and tightening. It is also effective for hair removal and used for cellulite reduction. Using radio waves in the skin is a similar process to how a microwave cooks food. Medical devices that use this technology are very strong, while those sold for home use are much weaker. Lasers and light therapy are advanced topics, and it is not necessary at this stage to learn all of the details concerning to these devices. They are mentioned for you to be familiarized with the technology, which continues to evolve. So Obviously, we talked a little bit about lasers in our chapter 11, which was hair removal, okay? So again, if any of you guys are interested in laser, and I know one of you have shared that you are interested. So again, National Laser Institute and Texas Laser are the most common ones. All right. Bottom of page 662, explain the benefits and type of light therapy. Light therapy is the application of light rays to the skin for the treatment of wrinkles, capillaries, pigmentation, or unwanted hair. Light therapy uses different types of devices, lasers, intense pulse light, again also known as IPL, and light emitting diode, LED technologies. The power and effectiveness of the machines vary and depend on such factors as the wavelength, okay? Heat and penetration power. The range of wavelength used in light therapy are visible, infrared, and far infrared. Okay, on page 663, what is infrared light and when do you use it? Light therapy with the use of infrared heat has been used for years to treat physical conditions such as pain and to promote healing. Infrared lamps have been used in salons for heating conditioners and chemicals in hair treatments. They are also used in spas and saunas for relaxing and warming up muscle, detoxifying the body, and reducing pain. There are used of near-infrared light for signs of aging, such as wrinkles, wound healing, and increasing circulation, as it is the longest wavelength of all the light therapies and thus can penetrate the deepest into the skin. So, therapeutic lamps are also used for light therapy. Color therapy uses different colors of light for various psychological effects. Red is considered stimulating, while green is more calming, okay? We know that blue is for acne, okay? What is IPL and when do you use it? Intense pulse light devices are similar to lasers. IPL devices use pulses of multiple wavelengths, okay, to reduce pigmentation, remove surface capillaries, and rejuvenate the skin. Same, intense pulse light emits light absorbed by hemoglobin, melanin, and hair follicles for hair removal. Photorejuvenation is another term used for the growing technology that utilizes light therapy to enhance the skin. It is a non-ablative, okay, treatment of extrinsic and intrinsic signs of aging, such as superficial vascular and pigmented irregularities, along with the loss of elasticity and collagen. You guys can see on page 664 at the top a picture of someone laying under a LED machine. And not sponsored, but Cellulite is probably one of the best ones out there. Look, I wish it was sponsored. As far as quality, they're FDA approved. Amazing, okay? So what are the effects of IPL? Common conditions that can be treated with an IPL device and photorejuvenation include the following: fine lines and wrinkles, skin texture, okay, including roughness and coarseness, telangiectasia and small spider veins, pigmented lesions, and dyschromia, okay? To name a few: rosacea symptoms, erythema or redness, flushing, and papules. So what LED is and when to use it? Please highlight the following and put a star next to it. LED, again, is an acronym for light emitting diode, a device used to reduce acne, increase skin circulation, and improve collagen content in the skin. LED technology is non-thermal, meaning, you guys, that it does not use heat. That is very important. Put a star next to that as well. LED technology works on the premises of non-thermal, non-ablative cellular stimulation called photomodulation. This action triggers a photobiochemical response versus relying on thermal injury, okay? As with lasers, estheticians use LED light for skin rejuvenation. LED individual wavelengths are used at low intensity and are not as strong as the laser and intense pole light modalities. LED uses visible light such as blue, red, or amber, and infrared and visible Different colors of light produce different effects on the skin. LED has been shown to help the limb system and increase ATP energy production in the cells. LED works by releasing light onto the skin to stimulate specific responses as precise depth of the skin. You guys, each color of light corresponds to a different depth in the skin. The LED color of light is also seeking color in the skin known as chromophore. The term chromophore is derived from the Greek word chroma, meaning color. A chromophore is a color component within the skin, such as blood or melanin. When the color light reaches a specific depth in the skin, it triggers a reaction such as stimulating circulation or even reducing the amount of bacteria. Okay? Handheld devices are increasingly popular. The use of machines, light therapy, and medical aesthetics continues to develop. Scientific discoveries and advances are changing the face of the anti-aging industry. Amen to that. Effects of LED in treatment. So, depending on the type of equipment, the LED can be blue, red, yellow, or green. So, let's look at the different colors. There's a chart on page 665. Effects of LED therapy. NM is for nanometers, by the way. So, color, red light. So, reaches anywhere between 640, 660 nanometers. So red light, the benefits of the red light, you guys, is to increase cellular processes, boosts collagen and elastin production, and it also stimulates wound healing, okay? Then we have yellow, 575 to 595 nanometers. It reduces inflammation, improves lymphatic flow, detoxifies, and increases circulation. We mentioned green light earlier, again, anywhere between 500 to 525 nanometers. Lessens hyperpigmentation. It helps reduce redness, calms and soothes. Put a star next to that. Calms and soothes. Blue light, 410 to 450 nanometers. Blue light, we all know it improves acne and helps reduce bacteria. So you guys, LED in the treatment room, honestly, I will recommend it 1000% that you incorporate LED in your treatments. Very, 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 very beneficial, okay, to the skin. Contraindications and best practices for LED: pregnancy, open and unidentified skin lesions, seizure disorders, autoimmune disorders. Okay, this is all very important. Clients taking photosynthesizing medication. As with all light therapies, it is important to make certain that you have viewed the client's consultation form for any contraindications. Light therapy should not be performed on anyone who has light sensitivity, for example, has phototoxic reactions, is taking antibiotics, has cancer or epilepsy, is pregnant, or is under a physician's care. If you are unaware whether you should apply a treatment, always refer the client to their healthcare provider, okay, and getting some sort of release form. LEDs are used in facials for approximately 15 minutes. Protective eyewear is a must, okay, to protect both the technician and the client's eye. The thyroid area should also be covered. The thyroid can be stimulated by the LED device as demonstrated by the off-label use of red light LED in the treatment of hypothyroidism by physicians. Okay? Safety and maintenance for LED machines should be maintained in accordance, again, by the manufacturer's instructions. The machine and protective eyewear should be disinfected, of course, after each use. But you guys already knew that. Discuss microcurrent treatments. So microcurrent or wave therapy device mimics the way the brain relays messages to the muscle. Therefore, you guys, microcurrent is used by the medical field to treat many conditions such as Bell's palsy and stroke paralysis, okay? The growing use of microampere electrical neuromuscular stimulation include healing muscle and wounds, controlling pain, and even fusing bones. There is even greater potential for this type of therapy. In the aesthetics realm, Microcurrent is used to relax muscle and to strengthen and tone the muscle by stimulating motor nerves and contractions of the muscle. Okay, the standard technique utilizes two handheld probes placed on facial muscle groups. A specific movement technique is used on all of the designated facial points. An ampule may be applied under the conducting gel, okay, or a conducting gel alone may be placed on the skin before beginning the treatment. The electrical current is regulated according to the skin's resistance. For visible results, treatments are given once a week for at least 10 sessions. Treatments must be given every 4 weeks to maintain the benefits and the results, okay? I always like to describe as microcurrent. It's like exercise for the face, right? When to use microcurrent, please put a star and highlight the following sentence. Many biological processes are associated with electrical impulses. Facial skin tone and muscles are all related to this system. As we age, impulses slow down, causing the skin to sag. Muscles may not completely contract after use, such as in the case of sagging jowls, okay? The same effect can be seen on the rest of the body as well. That is why exercise and stretching are extremely important as we all age, right? Microcurrent is thought to aid in the healing and repair of tissue and to influence metabolism. It works gently and helps speed up the natural regenerative processes of the body when the correct intensity of current and frequencies are used. Firmer and healthier skin are expected treatment results. Microcurrent devices are designed to work in harmony with the natural bioelectrical current found in the body. Some models of handheld devices are combined with ultrasound technology for addition penetration and added exfoliation effect, okay? Microcurrent combined with light therapy can be even more effective. When using any electrical device, you should obtain a complete client health history and conduct a consultation before the treatment. Contraindications are the same as those described in other electrical devices, okay? What are the effects of microcurrent? In aesthetics, microcurrent is used primarily to tone, okay? To tone and stimulate facial muscles. That's what microcurrent is used for. Considered a passive form of exercise, I just mentioned that, didn't I? This therapeutic technique helps stimulate motor nerves until a contraction of the muscle can be seen. Microcurrent has the ability to firm muscle and boost cellular activity. It improves blood and lymph circulation and can also assist with product absorption. In the past, faradic current has been used to stimulate motor nerves. Some contraindications are the following: open wounds, muscular diseases, advanced diabetes, someone that has a pacemaker, epilepsy, cancer, pregnancy, hemophilia, phlebitis, okay, to name a few, you guys. Typical recommended use for microcurrent treatment with injectables is to wait 2 weeks after the injection procedure. Something else I mentioned earlier. So at least 2 weeks, okay? You don't want to move anything around, especially if you paid a lot of money for it, right? Best practices and safety considerations for microcurrent. So as microcurrent movements are complex, potentially lengthy, and specific to the manufacturer's recommendation, and because the treatment depends on proper positioning, it is important to review muscle location, origin and insertion. Improper placement can result in no improvement at all, actually. Always follow the instructions and recommendations provided by the manufacturer of whichever device you are using, okay? And of course, safety and maintenance, again, in accordance with the manufacturers, the machine and protective eyewear should be disinfected after each use. All right, ultrasound. Discuss ultrasound. Ultrasound and ultrasonic are synonymous terms referring to frequency that is above the range of sound audible to the human ear. This equipment uses non-invasive sound waves to create result-oriented treatment. So ultrasonic equipment is based on high-frequency mechanical oscillations produced by a metal spatula. And you guys have already been using the metal spatula. So when to use the ultrasound technology? Please highlight and put a star next to the following. Ultrasound technology in aesthetics can be used for product penetration and for cellulite reduction. The vibration created through a water medium helps cleanse and exfoliate the skin by removing dead skin cells. Ultrasound penetrates deeply. It stimulates tissue, increases blood flow, and promotes oxygenation. Keep in mind that the lower the frequency, the greater the penetration. Conversely, a higher frequency has less penetration. Cellulite is affected through, the heat, manipulation of the tissue, and lymphatic movements performed with the device. Heat is created and the vibration in the cell stimulates circulation. The metabolism and lymphatic drainage. The heat damage from ultrasound and other modalities such as laser is what stimulates collagen production. Ultrasound also sends waves through the skin to assist in product penetration. This process is called sonophoresis. You guys remember that one? Which is similar to iontophoresis, Some aesthetic ultrasound equipment is rated as an FDA Class II device and may not be within an esthetician's scope of practice outside of a medical facility. Advanced training and technical research on equipment claims are necessary before using any advanced aesthetic machine. Different frequencies of ultrasound are also used for medical imaging, physical therapy, pain management. Lower frequency ultrasonic devices are used for toothbrushes and even jewelry cleaners. Handheld devices for a consumer's personal skincare that are used at home are milder but should be used in moderation to avoid damaging the skin. Because of its gentle, non-abrasive nature, this treatment can be a viable choice for clients with sensitive skin conditions or rosacea versus other exfoliating services. As gentle as ultrasonic therapy is, some clients are still not good candidates, So contraindications and precautions for ultrasonic technology include open or unidentified skin lesions, again, heart conditions, pacemakers, everything is pretty much the same as the other ones that we already read, To avoid excessive heat buildup and unstable cavitation, it is important to maintain constant movement, that is true, of the handpiece on moist skin. Caution should be exercised with fragile skin and in thin, delicate areas such as near the eye, Safety and maintenance, again, making sure that you're following the manufacturer's instructions, On page 669 at the bottom, we are going to discuss microneedling and nano-infusion. It should be noted that not all states allow estheticians to perform microneedling or dermal rolling and categorize it as a medical procedure requiring physician's supervision. So what is microneedling or dermal rolling? Cosmetic and medical rolling, also called microneedling or dermal rolling, is a form of collagen induction therapy. This procedure causes tiny needle pricks across the skin from rollers, which I'm not a fan of, or electronic handpieces that induce collagen formation during the wound healing process, Nano-infusion. Nano-infusion is a popular technology used by estheticians, in states that do not allow microneedling an esthetician scope of practice. Nano-infusion technology includes the use of a microneedling handpiece, but needle-free nanotips versus the standard microneedling tip that has needles that punctures the skin and can penetrate to the dermal level. So depending on how aggressive you are with the microneedling handpiece setting, the nano infusion tip is a popular alternative treatment because it is not invasive. It uses a single-use, sterile cartridge made of silicone or surgical steel pyramid-like modules that are microscopic. The pyramid modules are smaller than one single strand of human hair and almost invisible to the naked eye. This specialized design allows for a safe treatment with no downtime, as the nanotips do not penetrate into the dermis. The science behind this treatment is to create thousands of microchannels per minute on top of the skin, while the vibratory action of the microneedling handpiece assists in penetrating in the topical product of choice. Okay, we're on page 670. So very interesting. And so again, because you guys are not allowed to microneedle, nano infusion would be something that I would also recommend to help with penetration of products. All right, now we're going to start talking about body treatments, okay? So describe spa body treatments. Again, page 670. Spa treatments provide a wonderful, relaxing experience. Body treatments have a therapeutic effect and treat the skin of the whole body. They include wraps, scrubs, and masks. Be mindful of contraindications and allergies to ingredients, okay, such as seaweed and nuts before working on clients. When to use and effect of spa body treatments. So body wraps. Body wraps are popular. They're treatments where product is applied on the body and then covered or wrapped up. Wraps are used for various reasons and can remineralize, hydrate, stimulate, detoxify, and promote relaxation. The product used will determine the effect and results. Aloe gels, lotions, oils, seaweed, herbs, clay, or even mud products can all be used for wraps. Linens or plastics can be used to wrap clients and to promote product penetration. Blankets or sheets are the cocoon of the wraps. Inch loss wraps, another type of wrap, are designed to flush toxins out of the body and promote inch loss. Inch loss wraps have a diuretic effect and are controversial in their effectiveness. If done properly, detoxifying the body may aid in even weight reduction. Okay? Please highlight and put a star next to body scrubs. Body scrubs use friction to exfoliate and hydrate, increase circulation, and nourish skin using a combination of ingredients such as ground nuts, apricot kernels, cornmeal, jojoba beads, honey, salt, or sugar combined with oil or a lotion. Exfoliation treatments are also called polishes and glows. Exfoliation prepares the skin to receive additional products or treatments. Dry brushing is also beneficial, and it is used to exfoliate and stimulate the skin. Okay? Then you have your body mask. Detoxifies the body using primarily clay, mud, or seaweed mixtures. Okay? Certain body masks are used to also treat cellulite. Then we have hydrotherapy, is another spa treatment that uses water. It is three form: ice, steam, and liquid. Hydrotherapy tubs, Scotch hoses, Vichy showers, and you can see in the picture on page 671 what a Vichy shower is looks like. 672. We have balneal therapy. So balneal therapy, you guys, is, please highlight and put a star next to it. Balneal therapy is a treatment of physical alignments using therapeutic water baths, mineral mud, or fango. Dead sea salt, seaweed, enzymes, or peat are used in the baths. Okay. All right, then you have your stone massage. It is a technique of using hot stones and cold stones in massage or other treatments. Okay, facial stone massages can be incorporated into regular facials. Foot reflexology. Put a star next to foot reflexology, you guys. Okay. Foot reflexology is a technique of applying pressure to the feet based on a system of zones in areas on the feet that directly correspond to the anatomy of the body. Reflexology is performed on the feet, hands, and ears, as these are the areas that correspond to the body's zones. It causes relaxation, increased circulation, and balance the entire body. Estheticians are not usually trained in reflexology, so be aware of your scope of practice and licensing regulations. Okay. Next, we have on page 673, please highlight and put a star next to the following. We have Ayurvedic, okay? Ayurvedic concepts are based on 3 doshas or mind body types. Treatments include Shinra, massage, and facials using a client's Indian concepts and ingredients suited to the 3 body mind types, Pitta, Kapha, and Vata. Okay, please put a star next to that as well. Okay, then we have sunless tanning products application. Okay, so spray tan, you guys. Then you have endermology. It's a treatment for cellulite. It helps stimulate the reduction of adipose tissue by a vacuum massage that combines a vigorous massage along with suction. That's become really popular. Endermology. Then we have Reiki, another thing that has become very popular. So Reiki is a Japanese technique for stress reduction and relaxation. Also promotes healing. It is administered by laying on laying on hands, and it is based on the idea that an unseen life force energy flows through us, and it is what causes us to be alive. Okay, so there's other energy practices, include energy balancing and chakras. According to an ancient Hindu philosophy, our bodies have 7 major vortexes through which we process our life's force energy. So again, if you are into all of this, then there is definitely additional training you can do. All right, you guys, so we're on page 674. Discuss common treatments used to address cellulite. Please put a star next to cellulite. Okay, everything that you see that I have highlighted and have stars next to, you guys know will simply help you answer your chapter 13 test questions. Okay, so we all know, okay, if you don't, lucky you. Cellulite appears as dimpled or bumpy skin caused primarily by female hormones and genetics. Cellulite consists of fat cells. Dermal fat cells do swell, but that is not the only cause of cellulite. Cellulite is visible when dermal fat cells are closer to the surface of the skin. This occurs from damage to the dermis. If water is lost and the tissue is weakened, then dermal fat begins to push up into the dermis, causing that bumpiness. Additionally, if the epidermis is weakened or dehydrated, cellulite is obviously more visible. So drink your water, ladies. Keep collagen and elastin healthy. Keeping collagen and elastin healthy helps reduce cellulite. To repair cellulite cells and connective tissue need to be strengthened and obviously hydrated. Put a star next to that. Through nutrients and water intake. Drinking water is not enough. Our cells have to be able to hold on to the water. Wasted water in the body builds up and leads to water retention and puffiness. Blood flow and the circulation of nutrients through blood vessels up to the skin also affects cellulite. Repairing cell damage, connective tissue damage, and stratum corneum damage is important in treating cellulite. So the following recommended nutrients and ingredients may be beneficial for cellulite reduction. Okay, so we have lecithin and lipids for cell walls. We have gags for moisturizing and firming. Glucosamine to build gags and connective tissue. B vitamins to retain moisture and provide nutrients. Amino acids for building collagen and elastin. Essential fatty acids to attract water for the connective tissue. Of course, antioxidants, anti-inflammatories, aloe vera, an anti-inflammatory that improves hydration and contains enzymes and minerals, AHAs, alpha lipoic acids to name a few. So the effectiveness of some endermology treatments, which we just talked about, is obviously controversial. Detox diets, liposuction, and muscle stimulating systems do not minimize cellulite. Some body wraps result in only more like a temporary water loss. Electronic devices with vacuum may reduce cellulite temporarily. Manual lymph drainage, okay, mesotherapy, derma fillers, lasers, chemical peels, and microdermabrasions have all been tried to help to reduce cellulite. Most of these techniques are considered to provide temporary results, and their effectiveness obviously varies. Increasing blood flow, stimulating collagen and elastin, attracting water to cells, and repairing cell membranes are recommended to reduce cellulite, okay? So professional cellulite treatments must be performed consistently in continuous sessions. A common spot treatment consists of exfoliation with a scrub or dry brushing followed by a detoxifying mask and wrap. Cellulite, these stimulate the metabolism and circulation, you guys. So to finish the service, a cellulite treatment cream is also applied, okay? Exfoliation and skin brushing are also very good for blood vessels and circulation. Another popular treatment is thalassotherapy, is the use of seawater as a form of many minerals and nutrients. Massage can also help soften hardened cellulite. Cellulite is a common condition for most women, and improving the health of the skin is a continual process. Unfortunately, it's a process, okay? Explain the benefits of manual lymph drainage. So please put a star where it says, this technique helps to cleanse and detoxify the body, okay? Congestion, water, and waste in the lymphatic vessels create edema in the tissue. Moving the fluid out of the body with light massage movements will decrease the swelling from excess fluids. MLD is a great addition to a facial or other treatments. It is also used both before and after surgery because it expedites healing and enhances cell metabolism. Mechanical lymph drainage is a very beneficial service performed with machines. Of course, advanced training course in MLD are available for both estheticians and massage therapists. However, some states require an advanced license before an esthetician can actually perform this service, okay? Let's describe the field of medical aesthetics. So medical aesthetics is a multi-billion-dollar industry, okay? The industry is constantly developing new products and services for our youth-oriented society. Plastic surgery, laser treatments, and injectables focus on maintaining a youthful appearance. Medical aesthetics integrates surgical and non-surgical procedures with aesthetic treatments. Estheticians also perform services such as peels, microderms, and light therapy, okay? Some assist with medical procedures and monitor patients' recovery. Additionally, home care products recommended by the estheticians help patients heal faster and maintain their skin's health. Because medical aesthetics is evolving, the esthetician's role can be shaped to fit the facility's needs. Each setting varies, so it is important to define the responsibility included in the esthetician's job description. Obviously, they will tell you what is expected of you. Clinical estheticians are well-trained, experienced, in some cases even certified. However, not all estheticians must be certified to work in a medical setting, okay? To work in a medical aesthetic setting. Most clinical procedures must be done in a medical office under a healthcare provider supervision. Medi-spas are medical clinics and spas combined in one location and offer both aesthetic and also medical services, okay? The most popular medical spa service are chemical peels, microderm, Botox, fillers, laser hair removal, and light therapy, photorejuvenation. Estheticians are not qualified to perform certain procedures, but it is important to be familiar, you guys, with all of them because many clients will be asking questions and utilizing these procedures in one way or another. Society is now flooded with information on medical aesthetics. Social media, it is part of modern society's continued quest for instant gratification and maintenance of physical beauty. Medical spas are a fast-growing segment in the beauty industry. Okay, so pre and post care. Estheticians perform pre and post care treatments and provide patients education before a cosmetic surgery, for example. These are important for faster patient recovery. Estheticians also provide facials, light peels, extractions, microderms prior to surgery. Okay, so that could possibly be some of your responsibilities. What else? Please put a star next to post-op care includes providing skin care for rapid wound healing and the avoidance of infection, decreasing inflammation, soothing and moisturizing, and providing for sun protection are the goals. Massage, massage, hydration, protection, and camouflage makeup are often part of post-op care. Okay. Obviously, you will be giving your clients home care instructions and all of that. Microdermabrasion and chemical peels. Glycolic treatments can be performed to precondition the skin before laser resurfacing or surgery. These lunchtime peels can enhance the strength and barrier function of the epidermis. Microdermabrasion benefits to the epidermis are similar to those provided by AHA treatments, although the effects are more superficial. Okay. Documentation. A patient's chart is a record of what the patient conveys and the esthetician observes, right? So assessments and analysis and a plan of action for treatment. Protocols from clinical procedures are followed. Patients' informed consent forms and treatment records are required and are part of the standard charting procedure. So again, other responsibilities. Other clinical procedures, you guys, would be numerous opportunities for estheticians are found in specialized clinical settings. Laser and medical centers offer hair reduction, spider vein removal, non-ablative wrinkle treatments, and other type of laser procedures. Please highlight and put a star next to non-ablative procedures do not remove tissue. Non-ablative wrinkle treatments use intense pulse light to bypass the epidermis and stimulate collagen in the dermis to promote wrinkle reduction. Okay. Injectables, Botox, derma fillers, injectables that are a large part of the industry. Injectables have become the fastest growing product in the medical spa industry. We're on page 678 at the top. Injectable fillers are substances used in non-surgical procedures to fill in or plump up areas of the skin. FDA-approved fillers are non-toxic, durable, biocompatible, and easy to use. These are the necessary attributes of a safe filler. Then it goes on to talk about Botox. Okay, it's a popular non-surgical clinical service. Okay. It is a neuromuscular blocking serum that paralyzes the nerve cells on the muscle when this serum is injected into it, okay? All right. Obviously relaxes the tissues and diminishes lines. Fine lines and wrinkles. All right, derma fillers, okay, also are used to fill lines, wrinkles, and other facial imperfections. As we age, dermal collagen, hyaluronic acid, and fat are lost and the skin loses its shape. So usually that's where fillers will come in, right? Please put a star and highlight where it says synthetic sources are silicone and hyaluronic acid, okay? All right. On page 678, 679, it's now talking about surgical procedures, okay? Reconstructive surgery, cosmetic surgery, forehead lift on page 679. Please highlight and put a star next to blepharoplasty is an eye lift. It removes fat and skin from the upper and lower lids, making them less baggy and crinkled looking. When sagging eyelids impede a patient's ability to see, it is a medical condition and may be covered by insurance. Okay. And all right. Then we have a rhinoplasty, which is a nose surgery. Okay. laser resurfacing on page 680, dermabrasion, trichloroacidic acid, these are peels, phenol, the strongest peel, can be toxic. Body procedures, okay. Please highlight and put a star next to sclerotherapy, minimizes varicose veins, okay, and other by injecting chemical agents into the affected area. Then you have a mammoplasty, which is breast surgery. Liposuction is the procedure that surgically removes pockets of fat. So again, the clinical esthetician, working as a clinical esthetician in medical aesthetics can be enriching, okay? This specialty requires compassion and patience because you will work with people who are in pain or who are experiencing physical trauma. Many patients feel more comfortable with the esthetician than they do with the doctor. You may not have time for more personal and empathic discussions. Remember to stay focused on the treatment goal and maintain professional roles at all time. The role of an esthetician can be invaluable in the medical setting and providing pre- and post-operative care and other patient services and education. Okay, a career in aesthetic is always exciting and fascinating. Advanced areas of study range from medical aesthetics to exotic body treatments, light therapy, AHAs for skincare, are two of the most effective tools available today to estheticians. Opportunities for advanced trainings are limitless, okay? There are many services you can specialize in. As the industry continues to grow, keep up with modern technology and changes. Even if they are not on your service menu, and you guys have heard me say this a lot of times, just because you don't offer a certain service, it doesn't mean that you have to, stop learning, stop growing. You want to know what is the newest thing out there, okay? After basic aesthetic techniques are mastered, it is natural progression to add advanced treatments to the services that you currently offered. This is the beauty of aesthetics that increase the ability to improve the health of the skin as the industry evolves. Educated and skilled estheticians will always be in demand. All right, you guys, so that pretty much concludes chapter 13. Do not forget about the procedures that are shown starting on page 682, 683, okay, and it goes all throughout, all right? It is showing how to perform a light glycolic peel on page 690, microdermabrasion with a diamond tip on page 692. So, and then of course you cannot forget about your glossary, and all of it ends on page 701. This chapter was very important. It had a lot of information. So you want to go over it multiple times, okay? If you followed me through the very end, thank you so much for watching. I definitely appreciate it. If you found this video helpful, don't forget to like, share, and subscribe, and I'll see you guys on the next one.